The Accula Flu A Flu B test performed in the Accula dock is a molecular in vitro diagnostic test using polymerase chain reaction and lateral flow technology. It enables the rapid qualitative and visual detection of influenza A and B. The Accula Flu A Flu B test is a point-of-care test that uses a nasal swab specimen collected from the patient with signs and symptoms of respiratory infection. This video explains the basic procedure for Accula Flu A Flu B test, which takes approximately 30 minutes to complete. Each test kit contains foil pouches, each containing a test cassette and a transfer pipette, sterile rayon swabs, nasal swab buffer vials, influenza A positive control swab, influenza B positive control swab, operating instructions such as instruction for use, and quick reference guide. Prior to running patient samples in the Accula system, please note the following precautions to assure accurate results. Read the instructions for use, quick reference guide, and operator's guide thoroughly. Follow all warning and recommended test and quality control procedures. Buffer vials, positive control swabs, rayon swabs, and test cassettes should be stored in their original packaging at room temperature, 15 to 30 degrees Celsius. Do not refrigerate or freeze any test components. Do not use any of the kit contents or reagents past their expiration date printed on the outside of the kit box. Do not open the foil pouch of the test cassette until ready for immediate use. The test must be initiated within 30 minutes of opening the foil pouch. Place the Accula dock on a flat, stable surface and insert the round DC connector of the adapter into the dock. Connect the power cord to the AC adapter and then insert the power cord plug into the electrical outlet. Good sample collection and sample handling is the important first step for an accurate test result. The following procedures are recommended for proper sample collection and preparation. Visually bloody or overly viscous samples should not be used. Only use the swab provided in the kit. To collect the nasal swab sample, gently insert the swab into the nostril that appears to have the most nasal secretion. Carefully insert the swab approximately 1 inch into the patient's nostril. Gently rotate the swab several times against the nasal wall and remove from the nostril. For best results, direct nasal swabs should be tested immediately after collection. If immediate testing is not possible, a direct nasal swab can be stored in its original packaging at room temperature, 15 degrees Celsius to 30 degrees Celsius, for up to 2 hours prior to testing. If a direct nasal swab cannot be tested within 2 hours, it can be refrigerated and tested within 24 hours from the time of collection. Once the nasal swab sample is prepared in the buffer, it may be stored at room temperature for up to 1 hour. Proceed with testing the sample at room temperature using the following procedure. Write the patient identification and testing date on the buffer vial label in the area provided. Remove the cap from the buffer vial and set it aside. Insert the swab sample into the buffer and rotate it 5 times, rubbing it against the wall of the vial. Remove the patient swab from the buffer vial and discard it into a biohazard waste container. Replace the cap on the buffer vial. Open the dock by pressing the black button located on the side of the dock. Verify that the dock screen displays Dock Ready Insert Cassette. Remove test cassette and transfer pipette from the foil pouch. Write the patient identification information and date on the cassette label. Insert the test cassette into the dock and press firmly to seat. Do not close the lid. Do not remove the foil tab on the cassette until immediately before testing. Verify the dock screen displays the message indicating the cassette has been inserted. Next, verify the dock screen says Add Sample, then close lid. Do not close the dock lid until the sample is added. The sample must be added to the cassette within 5 minutes of being placed in the dock. Invert the buffer vial to mix. Remove the cap from the buffer vial and set aside. Firmly squeeze the top bulb of the transfer pipette and while continuing to squeeze, place the pipette tip well below the surface of the liquid in the sample vial. Slowly release the top bulb of the pipette, which will allow the pipette stem to completely fill with sample. Please note, although some excess liquid may enter the pipette's overflow chamber, only the liquid in the pipette stem will be dispensed into the cassette. Remove the foil tab covering the sample port on the test cassette. Discard the foil tab. Once the tab is removed, add the sample immediately. Insert the tip of the transfer pipette all the way into the sample port of the test cassette until resistance is met. Squeeze the top bulb of the pipette firmly to dispense all of the sample from the pipette stem into the test cassette. Note, a small amount of liquid may remain in the overflow chamber of the pipette and this is normal. Dispose of the transfer pipette in a biohazard waste container. The dock screen will then display the following message: Sample loaded, close lid. Close the dock lid to begin the test program. Once the lid is closed and the test has begun, verify the dock screen displays test running and the remaining time. Caution: do not open the lid or move the dock during testing. The dock will continue to display test running until complete. The dock will beep at the end of the test and will indicate test completed, read results. Opening the lid prior to this message will abort the test. Do not move or unplug the dock while the test is processing. Open the lid of the dock and remove the cassette to interpret the results. Look closely when interpreting the results of the Accula Flu A, Flu B test. The appearance of any shades of a blue test line at the Flu A position indicates a positive result for the presence of influenza A. Positive result is valid with or without a blue process control line at the C position, as long as there is no negative process control line at the NC position. Likewise, the appearance of any shade of a blue test line at the Flu B position indicates a positive result for the presence of influenza B. Positive result is valid with or without a blue process control line at the C position and no negative process control line at the NC position. The absence of any blue test line at the Flu A and Flu B position and the appearance of a blue line in the C position and the absence of a negative process control line at the NC position is an indication of a negative test for Flu A and Flu B. The result is interpreted as invalid if there is the appearance of all or no lines at the C, Flu A, and/or Flu B and NC positions. If an invalid test is obtained, the sample may be rerun with a fresh test cassette only if the prepared sample in the nasal swab buffer vial has been stored for less than 1 hour at room temperature. Thank you for watching this instructional video for the Accula Flu A, Flu B test procedure from Mesa Biotech.